Welcome back, everyone. Joining us now in the studio is Dr. Adelaide Greer. She is an audiologist with Lafayette Hearing and Balance Center, and she's in to talk about something that affects many of us in Acadiana, and that is hearing loss as well as tinnitus, and what options you have for treating them. Dr. Greer, thanks for being with us. We appreciate it.
Thank you for having me.
First of all, you know, we all know a relative or a friend, or perhaps we're dealing with it ourselves, especially people in my generation who maybe listened to music too loud when they were younger. What is defined, what is the definition actually of hearing loss?
Hearing loss is a decreased sensitivity of normal hearing, normal sounds. So oftentimes you don't even realize that you have hearing loss. Typically, you'll see that you start to have trouble in noise. So maybe in a restaurant or in a crowd, you can't really understand what people are saying. You make people repeat themselves. That is typically where we kind of start to notice that maybe your hearing is decreased over time.
So those are some of the signs that you can look out for that let you know that you're losing your hearing.
Those are the biggest signs. There's a couple of them.
Now, we've also heard the term a lot, tinnitus. What is that, if I'm pronouncing that correctly?
Yeah, tinnitus, all the same. It's the sensation of ringing in your head, and no one else can hear it. And a lot of times it's caused actually by damage of your inner ear, of your hearing organ. And there's little tiny hair cells in our ear, kind of like blades of grass. And over time, if you kind of step on them and they don't bounce back, they fire to the brain. And so research kind of thinks that it is the brain perceiving a sound that's not there because the hearing organ is damaged and it can't bring it to the brain. So you start perceiving that ringing sound.
What are some of the most common causes of tinnitus?
Hearing loss is actually the #1 cause of tinnitus, and it's 80% of people that have ringing in the ears also have hearing loss, whether they realize it or not. But typically it can also be caused by different medications and other...
Thanks, Gary, and hello again. Joining us again in the studio is Dr. Adelaide Greer. Unfortunately, some technical problems interrupted our conversation with her. She's an audiologist with the Lafayette Hearing and Balance Center, and she's in to talk to us about hearing loss and tinnitus and some of the things that can be done. As we were exploring a few minutes ago, Dr. Greer, you were explaining to us what causes hearing loss and the problem with ringing in the ears, but we had just started talking about some of the options for treatment. What are some of the things that can be done?
Absolutely. So typically we kind of take it head on and we treat both the hearing loss and the tinnitus together in what's called sound therapy. And sound therapy is just basically listening to sounds. And now the little small hearing aids have a sound therapy program built into them. So the whole goal is to kind of retrain your brain to not pay attention to that ringing and to be able to hear the speech and focus on the speech and not so much the ringing. And they've had great success with them, and they kind of came out several years ago. And you know, patients really have loved them and found a lot of relief, which is good.
And I'm also told, too, that that hearing aids have made tremendous advances in the past few years in terms of technological abilities that, you know, in the old days, it seems like they were huge and
bulky
and bulky, but now it's the opposite. They're so discreet and easy to use.
They're very, very small, and everyone that has hearing loss, like I said, has a lot of trouble hearing in noise. So research is kind of geared towards that, and the technology has come a really long way with being able to compress the noise and focus on the speech signal, and it really helps someone's total quality of life. You know, you don't realize that you'll withdraw from society and withdraw from things that you love to do because you can't hear, you can't keep up, even like with the grandkids.
Exactly.
So, you know, that's my favorite part of my job too, is fitting the hearing aids and getting those people back out there and back into the social aspect of, you know, the life.
It must be a great feeling to do that. Now, if you'd like more information, you can log on to doucet, DOUCETENT.com for lots more information. And Dr. Greer, thanks for being with us.
Thank you so much.
We're going to take